Personal financial planning is how people manage their money for their daily needs and future goals. It is important now because of the rising cost of living and many financial challenges. We will focus on 3 issues, which is debt management, retirement savings challenge, and healthcare costs and insurance. Our aim is to explain the causes, impact, and give recommendations to help people improve their financial. Our group used a qualitative approach with secondary data. We collected information from academic journals, UiTM Digital Library, EPF, and Bank Negara Malaysia Report, as well as industry insight from PwC and KPMG. We focus on 3 issues: debt management, retirement savings challenge, and healthcare costs and insurance. Each was analysed for problem, impact, and implication, and supported with case studies such as AKPK, EPF Maisarah, and Maisarah. Finally, we developed practical recommendations for individual and policymakers.
Causes of high household debt are the rising cost of living, especially housing, food, and education, which combine with slow wage growth. Easy access to credit like personal loans and credit cards make it worse, while low financial literacy means many people don't understand repayment strategies. Lifestyle pressure also push people to overspend, and finally, economic shocks such as the pandemic and inflation force families to borrow for survival. Poor debt management has serious effects. Savings are reduced because most income goes to debt repayment, leaving little for emergencies. It also limits investment in property, shares, and mutual funds, which widens the wealth gap. Retirement planning is also affected since debt often takes priority over EPF contributions, leaving people with insufficient funds for old age. At the same time, high interest payments and defaults damage credit scores, while financial stress leads to anxiety, lower productivity, and family conflicts. For the case study, a good example is AKPK Debt Management Program. By 2022, more than 400,000 Malaysians joined this program to get help with personal loans, mortgage, and credit card debts. AKPK provides counseling, structured repayments plan, and financial education, which shows how professional guidance can help people regain financial stability.
For retirement planning challenge in Malaysia, retirement planning has become a critical issue. Many individuals are not financially prepared to retire comfortably. According to the Employees Provident Fund, 81% of members do not meet the minimum saving threshold of 240,000, which is the recommended basic amount of retirement. This problem was made worse during the COVID-19 pandemic, when emergency withdrawal under ICINA and ICISRA allowed more than 145 billion to be taken out, leaving many accounts severely depleted. At the same time, the rest of the gig economy means a large group of self-employed workers are not making consistent contributions, which increase their vulnerability in old age. The impact of this issue are serious. Retirees face financial insecurity, like they are struggling to afford food, housing, and healthcare. Second one, many are forced to work beyond the retirement age, which can reduce productivity and affect health. Third one, there is growing dependence on family members and government assistance, which creates intergenerational financial strain and fiscal pressure on the nation. Although reform like the Maisarah program and the new EPF account structure show progress, participant and saving level remain far below what is needed.
The first major cause of rising healthcare costs is the aging population. As people live longer, they require more frequent and specialized medical care, which naturally raises overall expenditure. Next, the increase in chronic diseases such as diabetes, cancer, and heart disease has placed additional pressure on the healthcare system, as these conditions require continuous and often costly treatment. A third factor is the rapid advancement of medical technology. While modern equipment and treatments improve accuracy and outcomes, they also come with very high implementation and maintenance costs, which are eventually passed on to patients and insurers. Beyond this, there are several additional causes driving healthcare inflation. Administrative inefficiencies within complex insurance systems add unnecessary overhead costs, making healthcare delivery less efficient. At the same time, a shortage of medical professionals has increased workforce costs, as hospitals and clinics need to offer higher pay to attract and retain skilled staff. Finally, lifestyle-related issues such as unhealthy diets, sedentary lifestyles, and stress have worsened health conditions, creating a higher demand for treatment. All of these factors combined contribute to the continuous rise in healthcare costs in Malaysia. Rising healthcare costs in Malaysia have wide-reaching effects. For individuals and families, higher out-of-pocket payments increase financial stress and sometimes lead to medical debt. So many delay or avoid treatment due to affordability, resulting in poorer health outcomes. Employers bear heavier costs in providing staff healthcare benefits, straining company resources. Hospitals and clinics face the challenge of offering affordable yet high-quality care, putting pressure on staff and services. At the societal level, these rising costs widen inequality, where wealthy groups access proper treatment while vulnerable populations are left behind, threatening both social cohesion and economic stability.
Now, I will explain the impact of the three issues, which is debt management, retirement planning, and healthcare costs. So first, saving and financial stability are affected. High debt and medical expenses reduce saving, leaving households vulnerable to emergencies. Second, investment and wealth are limited. Many cannot invest in property or shares, widening the gap between investor and those burdened by debt. Third, retirement planning is weakened. Debt and healthcare costs take priority over EPF contributions, leaving people with insufficient funds and dependent on family or government. We also see weak debt management, where short-term borrowing without proper plans leads to bankruptcy, poor credit, and limited loan access. Lastly, financial stress causes anxiety, lower productivity, and family conflicts, which can grow into social and economic problems. Overall, this shows the urgent needs for better financial education, policy reforms, and affordable healthcare and retirement plans to ensure long-term stability. So for debt management, we suggest two key solutions. First, improving financial literacy. By teaching people how to budget, manage credit, and use repayment methods like snowball, they can avoid excessive debt and build better habits for saving, investing, and retirement. Second, expanding AKPK's debt management program. This means giving more Malaysians, especially in rural areas, access to counseling and structured repayment plans. It will ease household financial stress and also reduce the risk of loan defaults that can affect the wider economy.
To address the retirement plan, we propose two solutions. First thing first, we can enhance financial literacy and early planning through education, social media campaign, and fintech tools to encourage saving and diversification beyond EPF. The second one, we can expand incentive and coverage for gig workers, such as increasing Maisarah benefit and integrating retirement saving with e-wallet and digital platform. By implementing this step, Malaysia can reduce the retirement saving gap and improve long-term financial security for its people.
Alright, for healthcare costs and insurances, number one is adopt value-based insurance models. Preventive and chronic care should be a priority among insurance providers who should reduce co-payments of basic services. So this lowers long-term claims costs by averting costly hospital stays and makes insurance expenses align with improved health results. Number two is expand public-private partnerships, PPP, in insurance coverage. Governments ought to work together with the private insurers to come up with hybrid plans whereby basic health services will be subsidized and additional coverage will be availed at reasonable premiums. And the model decreases the fiscal burden on the governments and enhances affordability by households. So to conclude, the issues of debt management, retirement planning, and rising healthcare costs are deeply interconnected. Together, they create financial strain on households, reduce long-term security, and widen inequality across society. The way forward is clear. Malaysians need to strengthen financial literacy, begin retirement planning earlier, and support initiatives that make healthcare more affordable. By addressing these challenges collectively, we can build stronger financial resilience, protect vulnerable groups, and move towards a more stable and sustainable financial future. So that's all from us. Assalamualaikum warahmatullahi wabarakatuh.